So your cardiac index is going to be a much more specific reflection of how your individual patient's heart is functioning, because it's going to tell you how many liters per minute per square meter that heart is functioning at. So instead of just the liters per minute that your cardiac output tells you, now it's going to be calculated based on the patient's body surface. And what did I say the normal was for cardiac index? Did I put on your slide? 2.6 to 4.2 liters per minute per square meter. And we're going to use that pulmonary artery catheter to measure that. The pulmonary artery catheter can tell us what your cardiac index is based on, because it's going to be able to measure your cardiac output, and you will have plugged in the data that reflects the patient's body surface area. So it will tell you that you have a normal or an abnormal cardiac index. So we have a patient with chronic heart failure who is on a low sodium diet, reports a 5-pound weight gain in the last 3 days. The nurse's first action will be to have the patient recall dietary intake, instruct the patient regarding low-cal, low-fat diet, assess for clinical manifestations of acute heart failure, educate the patient about diuretics. And I know what it's going to do. Okay, there we go. Okay, 95% said assess for clinical manifestations of acute heart failure. Why did you do that? You always got to assess first. And then you can do all that other stuff, the education and all that other good stuff. But you need to assess, because a 5-pound weight gain in 3 days, we got problems. Patient receives IV Lasix 40 milligrams and Vasotec 5 milligrams PO BID for ADHF with severe orthopnea. The best indicator the treatment has been effective is weight loss of 2 pounds overnight, improvement in hourly urinary output, reduction in systolic BP, decreased dyspnea with head of bed at 30 degrees. Love it when this happens. 24% weight loss, 43% hourly output, 14% systolic BP, 19% in decreased dyspnea. So let's look at the question. What are the key words? Best indicator, but what else is key? Severe orthopnea. This question is wants you to focus on what would be the best indicator based on his orthopnea that would tell you that the diuretic is working and the Vasotec is working. So that would be number 4, decreased dyspnea with the head of the bed at 30 degrees. Yeah, you're going to see, you'd love to see a weight loss of 2 pounds overnight. You'd love to see an improvement in hourly urinary output, and you would see a reduction in systolic BP. But in that question, they're asking you what sign as it relates to the severe orthopnea, and that would be decreased dyspnea. So very carefully read these. And also, even if you didn't have that in there, ABCs, priority. Number 4 talks about breathing, right? You should pick that anyway. Yeah. The home care nurse finds an elderly patient with chronic heart failure, with severe dependent edema, with his legs weeping, serous fluid. Based on these data, the best nursing diagnosis is activity intolerance related to venous congestion, disturbed body image related to massive leg swelling, impaired skin integrity related to peripheral edema, impaired gas exchange related to chronic heart failure. Okay, 57% went with the skin integrity and 43% went with the gas exchange. Okay, what are the key words in this question? Severe edema with legs weeping, serous fluid based on these data. When it says that, when you see that phrase based on this data or anything that kind of, just say, okay, this is telling me I need to focus on something in particular and not the most obvious. So, legs weeping, serous fluid, severe edema. The priority for this patient based on that data is the impaired skin integrity. But a lot of you wanted to go with gas exchange because we saw ABCs. Chronic, and there's nothing in here that says he has any problems with his breathing. His problems are the dependent edema and the weeping legs. The patient is receiving dobutamine, Dobutrex, for the treatment of acutely decompensated heart failure. And you're like, oh my God, I don't know what this medication is. Do you need to know that? No, because which action will be best for the RN to delegate to an experienced LPN, LVN? Teach the patient the reasons for remaining on bed rest, monitor the patient's BP every hour, adjust the drip rate to keep the systolic greater than 90, call the healthcare provider about a decrease in urine output. So 77% said monitor the BP, and 23% said adjust the drip rate. Okay, we're in NCLEX land. Can we assign the IV to the LPN? No. So teaching, IVs, calling the physician, getting doctor's orders, again, can we delegate that to the LPN? But we can have the LPN monitor the blood pressure, gather data. The nurse teaches the patient with hypertension about diet modifications. Which should be implemented to manage blood pressure? Oh, that should be implemented. Which diet choice indicates the teaching has been effective? Patient has a glass of low-fat milk with each meal. Patient has only 1 cup of coffee in the morning. Patient restricts intake of protein. Patient has tomato juice and bacon for breakfast. I like number 4, actually. Okay, come on. Oh, you're going to give me problems again. There we go. Okay, 85% said 1 glass of low-fat milk with each meal. 5% said cup of coffee. 10% said restricting dietary protein. So we need to eliminate, only 1 cup of coffee in the morning. We really should tell that patient with hypertension to have no cups of coffee in the morning. The glass of low-fat milk with each meal shows that they understand that they need to be eating things that are low in fats and cholesterol and avoiding caffeine at all costs. The 62-year-old patient with sudden onset severe headache, nausea, blood pressure 240/118, takes clonidine, captopress, and hydrochlorothiazide, hydrodiaryl for hypertension. The most appropriate question by the nurse at this time is, have you recently taken any antihistamines? Have you been taking the captopress and hydrodiaryl lately? Do you have any recent stressful events in your life? Did you take any Tylenol today? 81% asked if you've been taking the captopress or the hydrodiurol lately. Why is that? Right. The patient's blood pressure is out of control. First thing you got to ask them is, are you taking your meds? Before you do anything else. Sure, antihistamines can raise the blood pressure. Anxiety and stress can raise the blood pressure. But you first all have to get that baseline information is he taking his meds? Because that's not taking your antihypertensives is going to put you into this condition, which is malignant hypertension or hypertensive crisis. The charge nurse observes a new RN doing discharge teaching for the patient who has a new prescription for enalapril, Vasitec. And what class is that? ACE inhibitor. Charge nurse will need to intervene if the new RN tells the patient to increase dietary intake of high potassium foods, move slowly when moving from lying to standing, check the BP with a home BP monitor frequently, make an appointment with the dietitian for teaching about low sodium diet. Okay, 77% said increased dietary intake of high potassium. 23% said make the appointment about the low sodium diet. So this is what type of question? It's a negative option, false option question. So should they move slowly from lying to standing? Yes. Should they check their BP frequently? Yes. Should they make an appointment for teaching about a low sodium diet? Yes. Should they increase high potassium foods? No, because ACE inhibitors tend to make a patient retain potassium. So you don't want to push higher potassium foods. The nurse is taking the history of the client with suspected coronary artery disease who has episodes of chest pain when mowing the lawn. Because it subsides when the client rests, the nurse correlates this with which condition? Unstable angina, stable angina, myocardial infarction, aortic aneurysm. Okay, 96% called it stable. What was the definition of stable versus unstable? It stops with rest and or nitro and it comes on with activity. Unstable angina does what? Comes on without any correlation to activity, but it subsides with rest or nitro. For which clinical manifestation of myocardial infarction should the nurse monitor in the older adult? Pain on inspiration, posterior wall chest pain, disorientation or confusing, numbness and tingling of the arm. Okay, 76% said disorientation or confusion. Why is numbness and tingling of the arm incorrect? Because anybody who has an MI might have numbness or tingling of the arm. And they're asking you to specifically say what's different about the older adult versus anybody else who might be having an MI. So that's how you read that question, is you look at it like, how should you be monitoring it in the older adult? That's a red flag that says to you, okay, what's different about older people? Same thing if they asked you for women versus men. You would look at, okay, what's different in women oftentimes than in men? The nurse correlates which rationale with the administration of aspirin plus nitroglycerin to the client experiencing angina-like chest pain? Analgesic properties without sedation, vasoconstriction and improved blood flow, inhibition of platelet aggregation and clot formation, cardiotonic properties and improved contraction. Okay, 68% said inhibition of platelet aggregation and clot formation. So they're basically asking you what here? Why are you giving the aspirin? A lot of words to basically ask you, why are you giving the aspirin? And it's to inhibit clot formation. Which specific actions or precautions will the nurse use when providing care to a client receiving thrombolytic therapy with streptokinase that differ from using TPA? Assess neurostatus every hour, observe all IV sites and wounds for bleeding, monitor for evidence of chest pain, observe for hives or shivering. Okay, 18% assess neurostatus, 14% observe IV sites and wounds, 5% observe for chest pain, and 64% observe the client for hives or shivering. So what this question is asking you is basically what's different about streptokinase than all the other types of thrombolytics, right? It's asking you to differentiate that because with all other types of thrombolytics, including streptokinase, you're going to assess neurostatus every hour. Why? Looking for signs of bleeding in the brain, right? Observing all sites and wounds for bleeding. All thrombolytics, you're going to be observing that. Monitor for evidence of chest pain. Yeah, I mean, if the patient is getting the streptokinase because of an MI, you'd want to monitor for chest pain, regardless of what type of thrombolytic. But would you, for all other types of thrombolytics, would you be looking for hives or shivering? No, because only streptokinase can cause an anaphylactic reaction. Okay, so